Hello, I'm Dr. Cheryl Wilson, and I'm a GP at Living Well with Dr. Wilson at 26K Avenue in Barrie, and I have a special interest and passion in sports injuries. Today I want to talk about youth or young athletes, because when it comes to athletes that are growing, there are particular conditions that they are more susceptible to. When an athlete is growing, or when anybody's growing, their bones grow first, and then over the next 6 months, the tendons and the muscles grow to catch up with it. So during that 6 months, those tendons and muscles are under increased tension and load. So if we've got an athlete that is physically active and we're doing sports in either more than one sport or more than one team, doing practices and games, well, those muscles and tendons are under increased tension. Then between how hard they're going, the intensity, how often they're playing, being active, the frequency, and how long they are doing it, the duration of these activities, can put a certain volume in through that loaded muscle and tendon and can cause problems. It can cause problems in the muscles, the tendon, or if it starts pulling hard enough, it can start pulling where it attaches on the bone. And a classic example is something called Oscillation, where underneath the kneecap, where you go to the front of the shin, there's a little knob on the knee, and that's where that big muscle, the front of the thigh, attaches through as it carries across the kneecap. And it can start pulling where it attaches. Another place is with soccer players, where on the pelvis, in the midline, where the muscle, the inner thigh, comes up and attaches on the pelvis bone, that can be a place where it pulls. And it's really crucial when you start having pain in these areas that you stop the activity. It's seen by a sports person so that you're seen by someone that has experience in these types of injuries and sports-specific experience. Because if you keep playing through this, it will get worse, it will take longer to heal, and if you keep pushing through long enough, it can develop into something that will be an ongoing problem for the rest of their life when they try and be active. So what you want to do is catch it immediately and give it the respect it deserves. See someone that can coach you through this, get you down to the point where they're pain-free, and then in a very graduated, safe way, get them back to being active safely. Which can mean with some athletes that they start off by being active, and then they have growth spurts, so they're going to have to ease off again, and then active again as they finish their growing until they can go off and be an adult, and hopefully they don't carry the problem with them. The other thing to be aware of with young athletes is their ligaments are stronger than their bones. So if they have had a sprain, you want them to be seen by someone who can look at it through the vision of a sports therapist, but also can order an x-ray, because they can have an avulsion fracture. And an avulsion just means that the part of the ligament that attaches to the bone has pulled off a little niblet of it. But it's still a fracture and needs to be treated like a fracture. The other kind of problem that young people can have is a green stick fracture. So our bones are a little bit bendy and have some give to them, much like a sapling in a tree. And that's why they call it a green stick fracture, when a young one doesn't have a full break or crack through the bone, but has bent it and injured the bone, and we still need to treat it like a fracture so that it can heal properly. The other thing to be aware of is that we can develop pains when we're young from problems like something called Perthes disease, in which we have an underlying condition that sometimes gets thought of as growing pains. Not a big fan of growing pains. You can throw in everything you don't know it is into that. There almost invariably is a cause, so you want to make sure you get to the cause, and you want to make sure there isn't a problem in the knee, or in particular the hip. And some people can have knee pain when the problem's in the hip. So if your child has persisting pain, then get them in to see someone that is aware of these conditions and make sure not missing them, because they need to be taken care of right away. So something that's really important to know for all youth is that they should be vigorously active for 90 minutes a day. That means out of breath, running around like mad men and mad women and getting all their energy out. They sleep better, they learn better, they are mentally healthier, and they are physically healthier. And it is a vital aspect of their life. So we want them out there daily being physically active and enjoying life. But if they have a problem, get them in, get them seen, and get them taken care of. See someone who has a special interest in training in sports injuries if you think that can be a benefit. And I wish you all the best, and I hope this has been a benefit.